Hello everyone, welcome back to our channel. Today's topic is an important topic in the neuroanatomy, cerebrum, sulci and gyri. So we have covered so many topics in the neuroanatomy videos. Those who have not subscribed to the channel, do subscribe now. Keep watching the videos. We will move on to the topic, cerebrum. In this video, mainly we will see the sulci and gyri on the superolateral surface of the cerebrum. And the remaining surfaces, sulci and gyri, we will see in the next video. If you see the cerebral hemispheres, they are separated from each other by the median longitudinal fissure. So that's a deep fissure. If you have seen the cerebrum like this, in between that is a deep fissure, that is the median longitudinal fissure. Each hemisphere presents 3 surfaces, 3 borders and 3 poles. Before we move on to the surfaces, borders and poles, we should know about the types of the sulci and gyri. Functionally, the sulci may be limiting, axial or percolated. We will see one by one what is that. Limiting means it is in between 2 functional areas. Then that sulcus will be called as the limiting sulcus, and example is the central sulcus. Axial is, it is in the middle of a functional area. So that is how it is called. It is like if it is one functional area, it is in the middle of that functional area. That's why it is called axial. Example, posterior part of the calcarine sulcus. Operculated. Operculated is, we have to remember, opercula means lid-like. So that this lid is having many functional areas in its walls, lips, floor. Then that will be called as operculated. Example is the lunate sulcus. So this is the one way of classification of sulci and gyri. This classification may be asked as short notes for you. So this is how 2 functional areas. So this is the one functional area and this is the another functional area. In between 2 functional area, that is the limiting sulcus, that is the central sulcus. Other classification we have complete and incomplete. What is complete and incomplete? You should know and you should have learnt that inside this cerebrum we have the ventricles. So if any sulci is extending up to the ventricles and produce impressions in the ventricle, then that sulcus is called as complete. Otherwise all are incomplete. So extends deeply into the ventricles, that is complete. We have 2 examples, collateral and calcarine sulci. Others are incomplete sulci. One more classification we have according to the development, primary and secondary. So if in the development, if it forms on its own, that is primary, developing independently. Secondary is dependent on other factors so that this sulcus are formed. Example is again lateral sulcus and PARIETO-occipital sulcus. So this completes the classification of the sulci and gyri. We have seen 3 classifications. One is functional and another is complete and incomplete. Another is depending on the development, that is primary and secondary. So this is the quiz time. We have a question for you. Give an example for limiting sulcus and axial sulcus. Have you answered? Okay, we will move on to the next slide. Now we are going to divide the cerebrum into lobes. How we have to divide the cerebrum into lobes, we have to see in this. Then we will see the sulci and gyri in each lobe. Each hemisphere is divided classically into 6 lobes. What are the 6 lobes? Frontal, parietal, temporal, occipital, which you will be knowing. We have 2 more we have to know now. Insular and limbic lobe. These lobes are separated from each other by some important sulci we have to know. They are central sulcus, lateral sulcus, parieto-occipital sulcus, pre-occipital sulcus, pre-occipital notch, cingulate and collateral sulci. So if we know these sulci, then we can know how we can divide the cerebrum into lobes. So these are the lobes of cerebrum. We have this yellow color is the frontal lobe. So this is the frontal lobe and this is the parietal lobe and this is the occipital lobe and this is the temporal lobe. Insula will be seen. So this sulci are you seeing here? This is the lateral sulcus. So this sulcus is present in the superolateral surface like this. So this sulci will be the lateral sulcus. So if you remove this parts of the cerebrum, then you will have the insular lobe. Limbic lobe we will see on the medial surface of the cerebrum. First we will know about the important sulci, then we will know how to divide the cerebrum into lobes. Two important sulci traverse this surface. First in the superolateral surface, students should know the two important sulci, central and lateral. Central sulcus is having the other name Rolandic sulcus or Rolandic fissure. It is, we have learnt already, it is a limiting type of sulcus. Lateral sulcus, other name Sylvian sulcus or Sylvian fissure. This consists of a stem and a three rami. So this is the superolateral surface and this sulcus is the central sulcus. If you see, it begins at the superomedial margin. So we have to know now margins also. So this is the superomedial margin and this is the infromedial margin, infrolateral margin. Infromedial margin we will see on the inferior surface. And this is the frontal pole and this is the temporal pole and this is the occipital pole. So these are the three poles and three margins. Central sulcus begins at the superomedial margin. If you take the midpoint between the occipital pole and frontal pole, the midpoint, slightly behind the midpoint, we have the central sulcus. If you see, it is not straight, it passes sinuously downward, making an angle of 70 degree with the median sagittal plane. So this sulcus is the central sulcus. Lateral sulcus of Sylvius consists of a stem and three rami. Stem we will see. Stem is present on the inferior surface and extends into the superolateral surface. It starts from the anterior perforated substance to the infrolateral margin where it divides into three rami, anterior horizontal, ascending rami and posterior rami. So you have to understand this stem is present in the medial surface, then it reaches the superolateral surface where we have the three rami of this lateral sulcus. So this is how the stem reaches this superolateral surface. This is the anterior horizontal rami, anterior ascending rami and this is the posterior ramus. So three rami on the superolateral surface of the cerebrum and stem is present on the medial surface starting from the anterior perforated substance to this infrolateral margin of the cerebrum. So we are continuing the lateral sulcus. Anterior horizontal and ascending rami, if you see, they are about only 2.5 centimeter long and this posterior rami is about 7.5 centimeter long. Area below this anterior horizontal rami will be called as the pars orbitalis. So this area is the pars orbitalis. Between the horizontal and ascending, this area. So this area is the triangular in shape. So that is called pars triangularis. Rest of the area above this posterior rami will be called as the pars posterior. So we are covering the sulci and the gyri adjacent to the lateral sulcus also. So now we are seeing the third sulcus. We have completed two sulci, central sulcus, lateral sulcus. Important sulci we are seeing in the beginning. Then the next important is the parieto-occipital sulcus, this small part. This is the parieto-occipital sulcus. So this is the parieto-occipital sulcus, cuts the superomedial margin of the cerebrum 5 centimeter in front of the occipital pole. So this is the occipital pole. Here from 5 centimeter we have this parieto-occipital sulcus. The remaining part of the parieto-occipital sulcus is present on the medial surface. So this part surrounding this parieto-occipital sulcus will be called as the arcus parieto-occipitalis. So if you see what is pre-occipital notch, opposite to this parieto-occipital sulcus on the inferolateral margin, this part, this notch is called the pre-occipital notch. Again, this is 5 centimeter in front of the occipital pole. So all these are the landmarks. We have to see how we can divide the cerebrum into the 4 lobes. So what are the lobes of the cerebrum? This is the question. You have to answer how many lobes are present in the each cerebral hemisphere. How to divide the superolateral surface into lobes? First line joining the parieto-occipital sulcus and pre-occipital notch. We will see it. So this is that first line joining this is the first line joining the parieto-occipital sulcus and the pre-occipital notch. The student should understand these are the two imaginary lines we are drawing. That's how we can divide this into lobes of the cerebrum. So this is the second line. This is the second line joining the lateral sulcus, that is the rami of lateral sulcus, with the first line. So we are joining here the posterior ramus of the lateral sulcus with the first line. First line is very important. You have to know how to draw it, joining the parieto-occipital sulcus and the pre-occipital notch. So we have learned how we can divide the superolateral surface into 4 lobes. What is the fifth lobe? So this is the insula, a pyramidal shape. You can see we have removed the cerebrum and white matter also in this part. Deep to the cerebrum we will have the white matter. So we have removed the part of the cerebral cortex and white matter. Again you are having the cortex. So that is the submerged cortex. It is pyramidal in shape. It is called as insula. It may be asked as short notes for you. In Insula, other name is the island of Rhea. Where it is situated? What sulcus we have removed here? Lateral sulcus. So we have to remove the sulcus so that we will have the insula. Situated at the bottom of the stem and posterior ramus of the lateral sulcus. So that is the situation. It is better when the opercula of the lateral sulcus is retracted. We can see this. It is a submerged cortex along the stem and posterior ramus of lateral sulcus. So this is pyramidal shape. This apex will be called as the Lyman insulae. So this is the apex. This is the apex, which will be called as the Lyman insulae, directed below and in front, and if you see it is continuous with the anterior perforated substance on the medial surface. So this is the quiz time. What is the other name of insula? Just now we have seen where it is situated. Again we will continue with the insula. If it is asked as short notes, you should be able to write the shape, situation, then the apex we have learned. Now a circular sulcus separates. So this is the circular sulcus separates the insula from the other opercle of lateral sulcus except at the Lyman insulae. Obliquely placed central sulcus divides this like this into a large anterior part and a small posterior part. So this is the small posterior part. Beneath the insula, if you remove this insula also, what we will see, what is the white matter and grey matter we will see is the claustrum, external capsule and lentiform nucleus. So that is the beneath the insula. So we have completed the insula. Side by side I have given the important points about the insula so that you will be able to write as a short notes. So we will now learn the sulci and gyri on the 4 lobes of the cerebrum: frontal lobe, parietal lobe and temporal lobe and occipital lobe. Insula just now we have covered. We will start with the frontal lobe. Precentral sulcus lies in front of the central sulcus. So we will see what is that. So this is the central sulcus we have learned just now. So in front of this we have the precentral sulcus. So this gyri is the precentral gyri. This gyri is the precentral gyri in front of central sulcus. Precentral gyrus mainly is motor in function. So in this, starting from this, it is important for you in the practical exam, you will be given like this brain specimen, and the important practical only one question may be given for you is sulci and gyri on the superolateral surface. If you answer this, you will be able to pass very easily in the practical exam. So follow this, at least sulci and gyri on the 4 lobes. So now I have started with the central sulcus, now precentral sulcus, and this is the precentral gyrus. Then if you see here, we have 2 important sulci, so that this part will be divided into 3 gyri, 2 sulci, 3 gyri. So the sulci we can name it as superior frontal sulci and inferior frontal sulci. So 2 sulci, so inferior and superior frontal, 3 gyri, so superior frontal, middle frontal and inferior frontal gyri. So simple sulci and gyri in the frontal lobe, precentral sulcus, precentral gyri. Superior frontal sulci, inferior frontal sulci. Superior frontal gyri, middle frontal gyri and inferior frontal gyri. Now we will see the next lobe, parietal lobe, post-central sulcus. So behind the central sulcus we have the post-central sulcus. Between the central sulcus and post-central sulcus, this part will be called the post-central gyri. Same like pre-central, this is post-central gyri. It will be sensory in function. In the parietal lobe, we have only one sulci. So we can name that as intraparietal sulcus. So that this part will be divided into superior parietal lobule and inferior parietal lobule. Frontal lobe we have learned 2 sulci and 3 gyri. Here 1 sulci and 2 gyri. So that is the superior frontal lobule and this is the inferior frontal lobule. Behind the superior lobule lies the arcus pareto-occipitalis, that is surrounding the pareto-occipital sulcus, that will be called as the arcus pareto-occipitalis. So this part will be the arcus pareto-occipitalis. That is the intraparietal sulcus. We will continue the parietal lobe. If you see this inferior parietal lobule, so this is post-central. This part is the post-central gyri and this is the superior parietal lobule and this is the inferior parietal lobule. So this part if you see, this is inferior parietal lobule. Inferior parietal lobule have present supramarginal and angular gyri around the upturned ends of the rami. That what rami we are having? Lateral rami. This is the posterior rami. So this is extending into the inferior parietal lobule. And also the superior temporal sulci is extending into the inferior parietal lobule. That lobule will, surrounding that will be called as supramarginal and angular gyri. We have a question for you. What is arcus pareto-occipitalis? Where it is situated? Now we will continue with the sulci and gyri on the temporal lobe. In this green color is the temporal lobe. 2 sulci, 3 gyri. Simple for us. Superior and inferior temporal sulci. Gyri will be the superior temporal gyri, middle temporal gyri and inferior temporal gyri. Now we will see the lobes, occipital lobe, sulci and gyri. Transverse occipital sulcus forms the posterior boundary of the arcus pareto-occipitalis. So the pareto-occipital sulcus, surrounding that we have the arcus pareto-occipitalis. The limit of the arcus pareto-occipitalis is this sulcus, that is called as transverse occipital sulcus. Lateral occipital sulcus divides the lobe into superior and inferior occipital gyri. Lunate sulcus is situated just opposite the occipital pole. We will see the labels, then you can understand. Yes, that is the lateral occipital sulcus divides the lobe into superior and inferior occipital gyri. That is the lunate sulcus, situated opposite, is like this lunate shape just outside the occipital pole. Calcarine sulcus is that sulcus which is cutting the occipital pole from the medial surface. Gyrus descendens intervenes between the lunate and the superior and inferior occipital gyri. So this occipital lobe we have seen, a transverse occipital sulcus, lateral occipital sulcus, lunate sulcus and calcarine sulcus. Gyri or the arcus pareto-occipitalis, a part we are having superior and inferior occipital gyri, then gyrus descendens. So we have completed the sulci and gyri on the 4 lobes of the cerebral hemispheres. So we have come to the summary. In this video we have mainly seen the introduction to the cerebrum, poles, margins, types of the sulci and gyri, and how to divide the superolateral surface into 4 lobes. Then we have learnt the sulci and gyri in the 4 lobes of the superolateral surface. Even we have learnt the insula which may be asked as short notes for you. The superolateral surface sulci and gyri may be asked along with the blood supply of the superolateral surface or along with the functional areas of the superolateral surface. We will continue with the blood supply of the cerebrum and the functional areas of the cerebrum in the coming videos. Those who have not subscribed to the channel, do subscribe now. Keep watching the videos. We will see the next neuroanatomy topic in the next video. Thank you.